Glenn Beck, Rush Limbaugh, Todd Schnitt, back-to-back every weekday. 99.9 FM, WXJB.
It's time now for a conversation with world-renowned orthopedic surgeon, inventor of the patented Bonati spine procedures, Alfred Bonati, MD. He's CEO and chief spine surgeon of the Bonati Spine Institute in Hudson. Good morning, sir. Thanks for coming on.
Good morning.
Listen, thank you so much for coming on. Mentioned this off air. You might not have heard me, but I did do the intro to you so folks know who we're talking with. But I said, we met for the first time last Saturday night at a July 4th event on July 5th, I believe. And we very quickly got into a conversation about Obamacare. And you've got some interesting thoughts on that. I want to say one more thing before we let you speak. Most doctors I've seen are willing to talk about it and usually don't have good things to say, but they don't want to do anything on air near a microphone where they can be recorded. You don't have a problem talking out about it, do you?
Absolutely not.
Tell us your problems with Obamacare, sir.
Well, Obamacare is a disaster for the nation. It's a disaster for the patients and the doctors. It's going to change medicine to a level that we will never recognize. It's going to change the doctors from individuals that they are today with care for the patient, knowledge in medicine, well-trained physician, to an individual who is going to learn how to push paper for the government. Happens today with Medicare and Medicaid. The bad situation with Medicaid is so incredible reported that if you are a patient of a Medicaid who is being treated by a physician who takes Medicaid, and you develop an acute illnesses that requires an immediate attention. For example, if somebody has an abdominal aneurysm and needs to be operated immediately, these patients, it is reported that 90% of those patients will die. And if it is the same patient treated by a private physician, 100% of these patients will survive.
Sir, let me ask you something. There are not many doctors speaking out against this, though. You can talk to them in private and get pretty much the same story. The doctors have the American Medical Association, but the AMA is not doing anything about this. Why?
Because the AMA does not represent doctors. AMA represents around 17% of the physicians in the nation. Unfortunately, it's not another organization who has the voice of the physicians. And this is one of the things that I planned in my mind to organize, because American Medical Association betrayed the physicians, signed for Obamacare, and that is why today we have all these problems. American Medical Association is not responsible on their actions to physicians. It's more responsible to insurance companies or social gathering, but it's not really strong to defend doctors in medicine.
So doctors really aren't organized as a group. You don't really have anybody in large group of doctors who can hire a lobbyist or a group of lobbyists and go and fight for what you guys see as problems with Obamacare.
Unfortunately, you're right. Physicians are very much a group of individuals that they are tamed by the law or by regulations. So they are scared to talk, they are scared to act. They try to put their heads like an ostrich on the hole. They do not react. It's a very, very coward society. They don't stand up to changes in law. And unfortunately, with that action, we are affecting enormously the health care of the patients. We ignore the time that these regulations are being enacted. Regulation is going to change the way that you treat your patient. One of the things that are going to happen in the very near future, you are not going to be treated by a doctor. You are going to be treated by a nurse practitioner or by a pharmacist or by somebody who's going to be a very poor training.
Well, let me tell you something right now. I mean, more often than not, when I go to the main doctor I see with some of my problems, it is a nurse practitioner who I would see. And let me ask you about this. I mean, you have pharmacies so often now. getting between the patient and the doctor? Is that going to get worse?
It's not going to only get worse. The direction of Obamacare is don't have specialists in the country. And because we have the best medicine in the world, it's not because we are the most capable people, but we are the better trained people. Mm-hmm. And medicine, when it's being treated by a specialist, this specialist has a support on the back of an industry. That industry creates new tools and new approach to anything that a physician feels that will be necessary for his practice. For example, if you have a problem with your eyes, you don't go directly to a general practitioner. You go to an ophthalmologist.
Right, sure.
So why you do that? Because the country is trained to go directly to the individual who has the better knowledge. They are going to change that. They are going to force you to go to see a general practitioner. So the general practitioner practically doesn't have the knowledge to treat you. So what happens, you are going to have a tremendous amount of damage in your eye before you are being referred to an ophthalmologist.
It's not happening immediately, but you see going forward, things are radically changing. It's a situation you hear a lot from doctors who have been practicing for a long time. We're talking with Dr. Bonati, by the way, and he is the CEO and chief spine surgeon at the Bonati Spine Institute in Hudson. He's been practicing for a while. Is this a situation largely because the new doctors just want to get the business, so they're not going to rock the boat? The old doctors knew how things used to be, and they see how messed up it is now and where it's going. Is it the new doctors are keeping their mouth shut because they want to make a living, even though it's not nearly as good as it used to be with you?
Unfortunately, this is like killing the chicken with the golden eggs, because what is going to happen is they are going to restrict the health care. They are going to restrict the things that you can treat. They are going to restrict the payments. And then suddenly the physician is going to become a clerk. This is what is happening today. Wow. If you really understand how the individuals of the Democratic Party are pushing a lot, is, for example, instead to talk about and say the doctor, they are talking about the care providers. This is an insult. This is an insult created by the system that is socialistic. The care providers, what the hell is a care provider?
Yeah, you're right.
The physician goes to 18 years of training. Some people go to 20, 24 years of training before they really touch a patient. And then you go and you call that physician a care provider.
You get lumped in with everybody else with a lot less training. Tell you what I'd like to do, if you don't mind, is I know you have a plan that you want to organize doctors. Can we come on again sometime next week and do round 2 of this, and you can tell me what you're working on? I'd love to do it, but I'm just up against the wall time-wise.
I will be more than happy, and I hope with this one I can start to gather other physicians that they can also speak about this problem. We need to protect medicine. We need to protect the patients.
Yeah. Dr. Bonati, it was a pleasure meeting you, talking to you, and I look forward to talking to you again, sir.
Thank you, sir.
You're listening to Mike Reeves in the Morning on 99.9 FM.